everybody. On this video, I would like to cover breathing techniques. Oftentimes, our breathing and our heart rate is linked to our emotions or maybe linked to our mental state. So our parasympathetic nervous system gets triggered and it'll induce rapid heart rate or rapid breathing, and it'll make you feel like you either are breathing too heavily or that you cannot catch your breath whatsoever. It can happen in instances when somebody is just having a nervousness experience whenever it comes to an event. They're getting flustered. It may happen when they're angry, when they're frustrated, when they're sad, when they are experiencing a symptom of their anxiety disorder or any other mental disorder they may feel, or in instances where someone is having a panic attack or known as an anxiety attack. So what happens is that parasympathetic nervous system gets triggered, and oftentimes it induces a feeling in that part of your brain, which they call the lizard brain, which is known for your survival instincts. It is the part that's primitive. It is also linked to, for example, back when we were cavemen, you were worried or flustered or in danger from an animal coming to attack you. So that part of the brain gets triggered and it induces that physiological effect that you are in danger, that you need to run away from that mammoth. And you may have heard of this, it's called a flight or fight response. Now, your body will think you're in danger and it is reacting in such a way, even if it's just a side effect of your psychological state. Perhaps you're feeling anxious, you're feeling stressed out, or you're rambling on in your head with negativity, which can happen, and sometimes our breathing follows that. And sometimes those physical symptoms can aggravate your mental state more, and vice versa, so you don't even know what started what or what is contributing to what. So a way to get out of it that can be constructive and can help you calm down will be breathing. So I'm going over a few techniques. First technique I would like to go over is blowing out the candles. This can be used for a child when they're feeling nervous, whatever it may be, big or small, every feeling is valid. Or it may be used for an adult who just needs to take a quick break of breathing. So what you can do, you can use a visual aid of birthday candles. And it can even help if you close your eyes and you hold your finger out as if that is a birthday candle, and you direct your breath to that. So for example, you ask yourself, how many birthday candles do I need to blow out? And let's say it's 3. Put out 3 fingers, close your eyes, breathe in, breathe out, blow the candle out. 1. Second candle. Third candle. Now that the candles are blown out, perhaps you feel better at this state now. This can be used probably for more acute variations of stress, something that you just need to use to calm your nerves. And you can use it anytime, anywhere, on yourself or anybody else. The second technique I would like to go over has to do with the visual aid. So with this one, you're going to use your imagination to visualize a light. And you are going to pair this up with muscle relaxation technique. So wherever you may be, whether you're sitting or lying down, I want you to close your eyes and visualize a white light. Direct that light into your feet and ankle region. Notice any sensation that's going through there. Is it tense? Is it tapping? Does it feel like it needs to run? Such as that part of the brain is telling you that you need to run from the mammoth. So I want you to breathe in. Flex your foot. And as you breathe out, relax it. Let it go. Now visualize that light going up to your calves. Notice the sensations. As you breathe in, Tighten the muscles in your calf. Breathe in. Now as you exhale, let go. Bring it up to your thighs. Notice any sensations. What materials are against that part of your body? Now as you breathe in, tighten the muscles in your thighs. Now breathe out and let go. Now notice your glutes/hip area. Notice the sensations. Notice the light. Breathe in and clench. Breathe out and let go. Notice if there's any tension or any sensation in your lower abdominals, your stomach region, and your lower back. See the light and focus your attention there. Now breathe in and tighten all those muscles. Breathe out and release. Now I'd like to focus that light and that attention onto your hands and wrists. Notice if your hands are fidgeting, if they're tapping, or if they feel tense. I want you to breathe in and form a fist. Now let go and exhale. And as you do that, visualize that white light being in the palm of your hand, uncovered after you unclench your fist. Focus the attention on your forearms and your upper arms. Is there any tension there? Any sensations? See the white light scan that area. Breathe in and try to flex those muscles. Now breathe out and release. Now on to the most important part, your upper back and your neck and shoulders. I know this is an area where we all commonly carry a lot of tension and stress. So I want you to focus a huge amount of white light radiating in that area. Breathe in and clench. Now breathe out and release. Feel your shoulders drop. Feel your lower back drop. Feel your neck a little bit more loose. Take a deep breath. Exhale. Open your eyes. On a scale from 1 to 10, how do you feel? Whatever it may be, whatever your score may be, repeat if necessary until you feel you are at a score that you want to be at. Now the third technique. This one is used in moments of panic, most commonly. And it helps bring you back into the moment because oftentimes you are in your head or you are externally overwhelmed. So, okay, I want you to take 3 deep breaths with me. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Look at me. I want you to list 5 things you can see in the space you are currently in. Give me 5 things. What's the first one? What's the second one? Third? Fourth? Okay. Find that last thing to describe that you see. Okay. Now I want you to list 4 things that you can touch Go ahead and touch it. Reach out to it. What surfaces are around you? What textures are around you? Give me 1, 2, 3, 4. Excellent. Now try to list 3 things you can hear. Quiet your mind and tell me, what 3 things can you hear right now? Really focus, whether you're in a quiet room or a loud space. Give me 1 thing. Give me a 2nd thing. Give me a 3rd thing. Good. Now, try to describe 2 things you can smell right now. Find an item that you can smell right now. Do you have a candle around you? Smell it. 1. Describe another thing you can smell. 2. Excellent. Now try to find 1 thing you can taste. If you have a food item around you, seek it and taste it. If you don't, a source of water. Give me 1 thing you can taste. Thank you. Feel free to visit that whenever you feel the need to. Bring yourself back to get back to yourself. That's my cat. You can be one of the things you see. Okay, and now as you do that too, that specific segment, if you feel the need to pause as I count down the things you need to find, feel free to do so. Watch it in whatever way you need to, whether you need to go along with my counting, whether you need to pause, or whether you need to just skip ahead into the other sensations once you find them on your own timing. Now take 3 deep breaths. The 4th breathing technique that I would like to go over is alternative nostril breathing. This is a skill and a breathing technique that I have acquired from yogic experience and yogic practices. What you're going to do, all you need, your nostrils. Even if you're congested, don't worry, you're watching this in the privacy of your own space. There's nobody that's going to see any congestion form or release. And get 2 of your fingers. So I want you to kind of form a little pickaxe, a little hook'em horns, well, kind of weird lopsided horns. It doesn't matter. But your thumb and your pinky. Choose which hand you like. Which one do you prefer, your left or your right? Which one do you use more? I'm going to use my right for this. What you're going to do is you're going to remember this number sequence. 4, 7, 8. You're going to breathe, cover your right nostril, breathe in for 4 seconds. Then you're going to pause for 7 and hold your breath. Then cover the other nostril and exhale for 8. Ready? I'll go through a couple rounds with you. Feel free to repeat it as many times as necessary. Inhale. Hold. Exhale. Inhale. Hold. Exhale. So in your mind it should be 1, 2, 3, 4. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7, 8. Feel free to repeat this as many times as necessary. Take it into your waking life. Share it with friends or family. Feel free to pay it forward. These breathing techniques should help calm your nerves. You can choose whichever one you feel fits you best. And feel free to repeat them as many times as you need to, and assess before you do each technique. Assess what your emotional level is at from a scale of 1 to 10. If you feel the need to repeat it, reassess yourself on that scale. And keep reassessing yourself until you are at the place you need. Just remember, you may be feeling like you can't catch your breath. Some individuals may feel like, have even described that they feel like they are going to jump out of their skin. But just try to breathe and try to allow that to calm your nerves. Sometimes that is simply the only thing you need to do. You need to trick your brain into realizing that it is calm. And that's all it needs for that parasympathetic nervous system to feel better, for that lizard part of your brain to know that it is not in danger. You are safe. No matter what your thoughts may be telling you, you are safe. There isn't a mammoth coming your way. Another helpful thing that you can notice in everyday life, you don't have to take the time out or carve the time out for this. In order to kind of synchronize with your vagus nerve, which has a lot to do with your emotions as well, and it is rooted inside of your brain, it's one of your 12 cranial nerves, is sometimes our emotions and that part of that nerve specifically gets confused as well with the way you're breathing. So in order to calm that down, I want you to take notice with how you're breathing. Is your stomach going in or out when it inhales and exhales? What's healthy and what your vagus nerve is pleased by and allows to calm those parts of your brain and the functions that it serves in your brain. Make sure when you inhale, keep yourself in check. When you inhale, your stomach should be going out. And when you exhale, it should be going in. Oftentimes we get caught up in inhaling through our chest and letting that expand while our stomach goes in. Keep it in check by allowing your stomach to expand when you breathe in, and for your stomach to go in when you exhale. If you notice, that is the way we were breathed as babies. If you notice a baby breathing, that's the way they breathe. And although it is an automatic thing that we do, sometimes we need to reset ourselves because we have forgotten how to breathe or how to breathe properly the way we did when we were once babies. So keep that in mind. You can do that within your waking life. You can do that while you're standing or in the midst of a situation. And carry that with you every day. Be there for somebody in need. Be there for yourself. Take care of your mental health. And have a great day. Thank you for watching.